The far end practices is really a term that I've coined to see if it resonates with colleagues. We know, for instance, about the excellent work that the deep end practices have done in Scotland, and they represent practices serving the most socio-economically deprived populations in Scotland. And really, their research has shown that deep end patients have greater levels of multimorbidity at a younger age, and they've got more mental health pathology and worse outcomes. And we know too that they've shown that the inverse care law really continues to play out there. That law that says that medical care tends to vary inversely with the need for it. And so I think with the far end practice concept, I'm trying to suggest that practices with significant numbers of elderly folks, really at the far end of their life, have an equally challenging situation as the deep end practices. And maybe we could say that they've got the same level of multimorbidity, but they've actually got associated frailty, sensory losses, and some of them have got reduced social capacity and maybe declining cognition as well.
What's the difference between a house call and a home visit?
I think a house call really is a slightly more impersonal concept of going out and seeing someone, maybe treating them as a medical or pathological entity or a problem to be solved. But a home visit is a privilege of going into someone's home and sharing time with them and discovering a bit more about their personhood and their personal journey in life, and understanding them in the context of their home environment and their family, and seeing what's important to them by looking around. And so you gain a huge insight into who they are, and that informs that psychosocial aspect of their health and well-being. It's not a house call, it is a home visit. And I think it's a real privilege to go into someone's house and share time with them and gain that holistic impression and picture of who they are, from a domestic and social perspective, as well as from a medical perspective and physical one. So I think it's really quite a privilege to go into people's homes, and I hope that we still continue to do that. And maybe we need to augment that with technologies as well, but I hope we don't lose the actual face-to-face. I would see that there is a role for advanced nurse practitioners or even some paramedics to go in and attend to some of the maybe more acute presentations. But I would be really hopeful that as GPs we could go in and still coordinate and be involved in our elderly patients with long-term conditions, and provide that face-to-face input with them, provide continuity of care for them in that way. So maybe a hybrid model where GPs are still involved, but maybe acute care, some of that being devolved to nursing colleagues or even paramedics.